Hi, my name is Matthew Mauriello from the University of Delaware, and I'd like to talk with you about SAD, a stress annotated dataset for recognizing everyday stressors in SMS-like conversational systems. So worldwide, mental health is a $1 trillion problem annually. This is because that when left untreated, poor mental health reduces productivity as well as job and life satisfaction. Complicating matters further is that while most primary care visits have a stress component, only 3% of patients receive stress management advice. As a result, we really need to think about how we can make stress management advice more accessible. So some of the things that technologists are noticing is that people are spending a lot of time with messaging apps and many support chatbots. So could this be an effective way to scale access? However, before we get there, we need data about mental health topics, including daily stressors, to build appropriate dialogues for these systems. In our late-breaking work, we ask, how do users of SMS-like systems describe daily stress? Might this data generate a dataset that can help classify stressors into multiple topics? And will the resulting models be viable in an SMS-like application? To begin exploring this topic, we constructed a prototype chatbot system composed of multiple short, simple, and specific chatbots that we hope to distribute across chatting platforms. When we say short, we mean the conversations are about 2 minutes. The idea is that they can easily fit into your regular schedule for daily stress management, and they are specific. Each bot implements one coping technique from stress management literature, including cognitive behavioral therapy and positive psychology. Taken together, this makes these chatbots easy to build, maintain, and discard should they prove ineffective. We implemented our initial suite of 9 chatbots on the messenger platform Telegram, which allows users to type naturally with the chatbots and uses regex rules to guide conversations. We ran a 1-week study with 47 participants who had 197 conversations, and we analyzed the conversational logs to determine how we might classify the topics of conversation, initially arriving at 8 stressor categories that included topics like work, health, and social relationships. We then turned to what the late-breaking work primarily focuses on, generating and evaluating a dataset of stressors, which we did using crowdsourcing and web scraping. First, let's talk about crowdsourcing. We used our analysis of stressful sentences to develop 2 human intelligence tasks that allowed us to synthesize, label, and validate our original and new data. Each stressful sentence was evaluated by 5 raters who could label the sentence with up to 2 categories from our schema, which expanded to 9 topics after iterating these hits with turkers. However, after synthesizing more data, we still had a problem with low cardinality topics. So we turned to web scraping and a repository of emotionally charged content from LiveJournal, which essentially allows us to search for similar sentences using word embeddings and cosine similarity. Once we run these new examples through our validation task, we're able to bring most of our categories to up to about 600 plus examples that we use in our evaluation of the dataset. First, we wanted to get a sense of how well this validation and majority voting mechanism work to determine labels, and to do this, we ran our collection through a support vector machine, and our results show, as you might expect, an increase in overall classification performance as we increase the number of raters. Next, we fine-tuned a BERT model where we randomly sampled from the dataset our training and test sets 20 times, and were able to produce good overall and multi-class classification results. Finally, it's important for us to understand something about performance time because we want to plug this into our chatbot system. Now, users when actively chatting with someone tend to expect a response time of about 2 to 3 seconds. So we deployed a Flask API to interact with our model, and then simulated users actively calling this API simultaneously, which for our purposes results in performance that is unlikely to impact future studies. So the next steps for us are closing the loop to create an active learning system that automatically gets new data from users while reducing our reliance on synthetic stressors and web scraping, which may have artificially inflated our earlier results. We plan to continue to iterate our topic categories and definitions such that we may in the future be able to release an improved data set for mental health applications. And something we present on in the paper is the impact of topic drift, which we saw as a result of the COVID-19 pandemic. And as a result, indicates we need to consider how to handle changes in topics that may come up as we expand our user base or that result from real-time events. So in sum, if you're interested in developing conversational or other systems that might be informed by daily stress classification, I hope you'll peruse our paper and visit our GitHub to get a copy of the SAD dataset. Thanks for listening.